Hi guys, it's Crystalline, your proactive conscious aging life coach. How are you guys doing today? I am joyful in the Lord and in the power of His might. Welcome back to my channel. On this channel, I talk about all things health, wellness, anti-aging, beauty, and lifestyle. And if you're new to the channel, I will ask you to please subscribe, like, share my videos, and hit that notification bell so you can get my videos just as soon as I upload them. One other thing that I really appreciate is when you guys make comments. Let me know what you think about the video, if you have any questions that I can follow up on. I usually answer my comments very quickly because I want to be responsive to you all. Thank you for my subscribers who are joining me again. I certainly do appreciate you guys so much. Today I have the second installment of the anti-aging series, the ABCs of anti-aging. You know, I have been a little remiss with this one, you guys. I started it a few months ago and I said that I was going to keep going with the series, and you know, so many things came up that I'm just now getting back to it, but you know, better late than ever. Better late than never, right? So that's what I'm going to talk about today. The first thing that I want to mention though is I'm going to just tell you something a little personal about me, and that is, you know how I greet you all the time and I say I'm joyful in the Lord and in the power of His might? I'll tell you where that comes from. That comes from the Bible, Nehemiah chapter 8:10, and that says the joy of the Lord is your strength. So I'm letting you know the joy of the Lord is my strength, and I'm trying to share it with you. So that's what I'm going to say all the time. I'm joyful in the Lord and in the power of His might. And then when I blow you a kiss at the end of the video, I'm sending out lots and lots of love to you. You know, I am so happy and excited to have my channel. You don't know how long I procrastinated before I actually started to make these recordings. It was one of my goals for 2022 was to start this channel and to just go on, because you know, I have a friend at Diamond Media, shout out to you my friend, who says that, quote, procrastination is the thief of time, unquote. I'm saying it like that because it's not my quote, it's my friend at Diamond Media's quote. Procrastination is the thief of time, and that is so true. You know, we don't have forever to do what we're going to do in life. So, you know, my daughter just encouraged me, Mom, just go ahead and do it. Everything doesn't have to be perfect. And so I just decided to go on and start recording. So you're seeing that right now. And my channel is evolving already. I started off with a certain niche of women over the age of 60, but I found that most of the people watching my videos were nowhere near 60. So I'm just gonna say a lifespan, wellness, and beauty. 60 is the new 40 because I'm 61, but you could be any age. So that's a little background there. And so let me stop preaching for right now and get on with this video. The first thing that I want to say though, before I get started with the ABCs, is that one of the main things that you can do to keep your appearance and to be proactive in your aging is to eat a lot of fruit and vegetables. And this is a snack that I'm going to have a little bit later on. I have green grapes, I have strawberries, and I have cherries. And I like my cherries really dark because I say the darker the berry, the sweeter the juice. You may have heard that before. So that's my snack for later on. I also want to encourage you to drink a lot of water. Our bodies need hydration. We need at least 8-ounce glasses of water every day. All of our bodily processes, you know, rely on water. And when we don't have enough water, it shows. We're dehydrated, our skin is dry, we may have some itching and flaking. So make sure you drink a lot of water and eat a lot of fruits and vegetables. Real beauty radiates from inside, and we cannot be beautiful if we're just eating a bunch of junk food and sugar, which causes inflammation in the body. All right, that's a whole other topic, but let me just remind you, please eat your fruits and vegetables and drink a lot of water so that you can get that naturally beautiful skin that we all love and admire. In part 1 of the ABCs of anti-aging, I left off at hyaluronic acid fillers such as Juvederm and Restylane. And I do have my computer here because I have everything here so that I can make sure that I get it all to you. So, hyaluronic acid fillers work by replacing lost volume to the face in areas that have become thin, and they restore a plump and more youthful appearance. If you've noticed, as we age and as you've seen some other people age, you can look at their face and they may have hollows here, they may have like lines and striations here. All that is coming from lost volume. So the dermal fillers help to fill in and restore those areas so that they're just not sunken in. Let me see. Hyaluronic acid draws water to the face. So we also have hyaluronic acid serums. I also take a supplement orally of hyaluronic acid because I want to make sure I have as much moisture drawn to my skin as possible. So the hyaluronic acid fillers, they work to decrease gauntness in the periphery of the face, which is around this area. And I know you know what I'm talking about when you see someone who looks very gaunt right here. Something that I read a long time ago, and it seems to be coming true right now in my own life, is that a woman may have to have a little bit more in the caboose in order to keep her face looking youthful. And the reason why is because as we age, we're losing that fat. And if you don't have money for plastic surgery and dermal fillers and you know, etc., fat fillers and fat implants, you know, we're going to get to all of them. If you don't have money for that, one thing that you can do is just maintain your weight a little bit higher. It's not going to kill you, and your face and your neck area are going to look a lot better. So, yeah, we want to overcome those effects of aging, because as we age, gravity pulls everything down, you know? So we're trying to keep things up. So if you're a little bit overweight, maybe 10 pounds, don't fret. And you might not even be overweight. Just keep a little weight on yourself so that you won't look terribly gaunt. And a gaunt appearance makes us look a lot older. So I'm gonna move on to I. And I is for IPL. And what is IPL? It's a broad-based light device that targets redness from rosacea or sun exposure and sunspots of the skin. It can be used to treat the face and the body, but it should be used with high hesitancy in skin of color due to increased risks of burns and hyperpigmentation. So, what does that mean? If you have skin of color like mine, don't use this. I just put it that way, okay? Because I don't want to get burned by accident and then have to go through, you know, changes trying to get my skin back to normal, or have a lot of hyperpigmentation. Of course, hyperpigmentation are brown spots. And sometimes if you have a pimple, or I've seen people try to get rid of acne and they use a lot of harsh chemical peels on their skin, and instead of that acne going away, well, the actual bumps, the pimples go away, but then they have dark black spots that just keep coming back because these things are too harsh for skin of color. So what I'm reading here is that this IPL risks burns and hyperpigmentation. It can also flare melasma. So what is melasma? Melasma is that mask of pregnancy, which is a pigmentation that a lot of women get over their face and neck area and even down here into the décolleté after pregnancy. It usually fades after time, but sometimes it doesn't. And so you don't want to do anything to activate that. And what they're saying here is that the IPL can also cause a flare-up of melasma. So you want to avoid this. I think that it would probably be best for people with rosacea or sun exposure, just as they're saying. Okay, sometimes when you go into a place and people are trying to sell you things, they might sell you the wrong thing. And I'm just going to fall back to those acid pills on dark skin. That's not the best thing, and you need to do your research while someone is trying to talk up a certain treatment. First of all, they may not be qualified to give that treatment. They may not understand how that treatment is going to affect your skin. They may think they could do it on anyone. So you might have to make sure that you do all your research before you try any of these treatments. Talk to some people, talk to some specialists, you know, before you even do it. You'll save yourself a lot of grief. So IPL, you're gonna use it mostly for rosacea. And so what rosacea is a lot of people have like these red patches around their cheeks. It's very hard to get rid of and it's very hard to cover. So IPL would be a light-based device, broad-based light device that would help you with rosacea. You know, one thing that I really have noticed over the last 20 years, and thank God, you know, I used to be a licensed esthetician. And what I've noticed and have been very, very impressed with is the amount of new technology that has come out just over about the last 20 years. There's so many new technologies and so many new treatments and the discovery of so many different kind of things that are going on in our skin cells and how skin works and how our bodies work, that there's really no excuse for us to look bad these days or to feel bad, because we know what to do to help ourselves do better and feel better. So let me move on to K. And K is for Kybella. And this is the treatment of submental skin fullness, or also known as a double chin. It's an injectable treatment that works to permanently break down the fat in that area. And after the treatment, the fat is permanently destroyed. So those of us who have that double chin, and thank God I don't, this is a treatment that you might want to consider. However, I'm going to question it, because what if you have, most of the time when people have, when a person has a double chin, the rest of their body is kind of double. So I don't know really how that would look to get rid of the double chin and then everything else is thin. Let me know in the comments. If you've had this Kybella treatment, you can tell us how that works. L. L is for laser lipolysis. And Dr. Bruce Katz says this. He says that I pioneered laser lipolysis and was the first in the country to do it. The treatment requires local anesthesia, and the laser fiber is inserted under the skin to melt the fat and tighten the skin. How does that sound to you guys? They're gonna melt the fat and tighten the skin. This is laser lipolysis, L. Excuse me for my pronunciation on some of these. The next one is microneedling, M. Now, microneedling is the creation of small injuries to the skin with acupuncture-sized needles. Did I say that? Acupuncture-sized needles. Now, you've seen people getting acupuncture before. They're very fine little thin needles that go into the skin, and they're supposed to help with pain and various problems with the body. So, the body responds to this to these injuries by stimulating the collagen, and it's used to help prevent fine lines, wrinkles, and enlarged pores, stretch marks, acne scars, and it also addresses textural concerns. This one I do not like. I'm just going to be honest with you. I don't think it would be great for skin of color. I would really research this before I got it, because skin of color has a tendency to keloid. And so what keloiding is, I'm going to show you, it's like an overgrowth of reparative tissue. So you have an injury. Instead of the sides of your skin just coming back together, it forms a big scar. So it looks something like that, if you can see that keloid there. And my skin is very keloid. I have a scar here and also a scar here. They're not that visible, and one day I'm going to tell you how I got those scars, but skin of color tends to keloid. So with me, I would be very careful about getting anything that's going to cut into my skin, because it might leave a scar. What do you think about that? So that's microneedling. I've heard a lot of good things about microneedling, and I haven't heard too many bad things, but I wouldn't get it. I put it there. I put it that way. And I'm going to read what it actually says about it. Microneedling is the creation of small microchannels and injuries to the skin with acupuncture-sized needles down to various depths depending on how deep the needles are set at. By creating these micro injuries to the skin, the body will respond naturally by stimulating and producing more collagen. That's a theory, okay? In-office microneedling procedures performed by dermatologists use sterile needles and puncture deep enough in order to cause bleeding, in order to deliver consistent and effective results. Okay, well that's it for me. Because I don't want any treatment on my skin that causes bleeding. You can tell me what you think about that in the comments. So that's microneedling. I'm just going to move on for that. All right. One thing that they give as a concern or problem that might happen is this. It says that if you're dealing with an inflammatory condition such as psoriasis or eczema, or you are actively tanning or sunburned, or have a skin infection such as cold sores, microneedling should not be performed. So we have a lot of skin concerns there where microneedling ought to be left alone. N is for niacinamide, and niacinamide is also known as vitamin B3. This ingredient can treat large pores, uneven skin texture, fine lines, hyperpigmentation, wrinkles, and also helps hydrate dry skin. So niacinamide can do everything, pretty much, okay? So that's a good one. Now we see niacinamide in a lot of cleansers, moisturizers, and serums. A lot of people love niacinamide serum. I have not used that one because I don't have those skin concerns of large pores or uneven skin texture. I use hyaluronic acid, I use argireline, I use retinol serums, and vitamin C for my skin concerns. But that's niacinamide. Some of you guys might have large pores and uneven skin texture, and you might want to try this. The good thing about a lot of these serums is that you can just do a patch test on your neck and see if you get any irritation before you use it on your face. They're not as, permanent as some of these things like microneedling, or they won't cause as much damage if something goes awry. Okay, P. P is for poly-L-lactic acid dermal fillers, known as Sculptra. I've heard of Sculptra. What about you? Now, Sculptra, it says, on the other hand, works differently than other filler options. It is formulated with poly-L-lactic acid. Sculptra stimulates your body's own natural collagen production, and the result is a very natural and soft appearing skin. That sounds good to me. It says that it's not an immediate change, but it happens over a period of months. So in other words, you're going to start off at point A, and then you're going to end up at point B a few months later, and it's going to be just like a natural rejuvenation. And that sounds pretty good to me. What do you think, you guys? Have any of you gotten Sculptra? If you have, put it in the comments. I like to have a conversation. Now here's another one, and this one is irritating slightly. It's called QWO, and this is the first FDA approved treatment, injectable treatment for cellulite, okay? And I'm gonna tell you right off the bat, I have a problem with this one, but I'll read it first. QWO is the first FDA approved injectable for cellulite that removes moderate to severe cellulite in the buttocks of adult women. Okay, let me grind to a halt right there. Cellulite, which are those little fatty appearing pockets that we get on the side of our thighs, on our buttocks, and even sometimes in the stomach area, especially after you had a baby. These cellulite is normal, okay? Once we hit puberty and the estrogen starts flowing, 99% of us get cellulite. So it's irritating to me when we have treatments for things that are absolutely natural, and then we want to kind of make women feel bad because they have it. So that's my gripe with it, because cellulite is just something that we get. I've seen the thinnest of women who have cellulite, you know, but now we have QWO, the first FDA approved injectable for cellulite. And you know, it's also kind of a contradiction, because on the one hand, we have the Brazilian butt lift, where we're, you know, sucking fat out of our fat areas and put it into our buttocks. And so you got a slim waist and you got this big booty in the back. So first of all, we want that, but then we got the other women who want to suck the cellulite out of the booty. You know, it's just, you know, we're all over the place with our aesthetics in this country. You know, when is it ever going to be okay for us just to have a normal body that we get through diet and exercise? This is just a question that I'm posing, you guys. I'm going to move on, though, because I tend to get a little fired up over things like that. R is for radio frequency lipolysis, and this treatment uses radio frequency to melt the fat. An electric current is applied to the skin and transmits an electric current to the fat level. It also tightens the skin, and there is a modest benefit at best. Patients will see a little bit of fat removal, and there are no side effects. To me, if you're only going to see a modest benefit, why don't you eat your fruits and vegetables and exercise? Go outside and skip some jump rope, ride your bike, do some kind of cardio, okay? I don't want to pay a whole lot of money for a modest benefit. So I guess what I'm trying to get at, you guys, is some of these treatments, and this is just my bias, some of these treatments are just a little bit far-fetched, okay, for the average woman. We're trying to buy gas right now, and they're talking about radio frequency lipolysis, okay? I can't afford that, and even if I could, I think I would take the natural route, which has, you know, stood me in good stead so far at the age of 61. You have to forgive me. My nose is itching for some reason, and that's why I keep going like that. So the last of our ABCs of anti-aging for today is retinol, and I'll tell you how this works. Retinoids, they work by prompting surface skin cells to turn over and die more rapidly. making way for new cell growth underneath. So basically, they are helping to get rid of this outer layer of dull skin cells and making way for the new. I like that. Out with the old, in with the new. That's what I say. They hamper the breakdown of collagen. They thicken the deeper layer of the skin, and that would be the dermis, because first we have the epidermis on top, and then we have the dermis. And that's where the wrinkles get their start. So retinol resets and stimulates the production of collagen and elastin. Instead of permanent results, retinol just kind of resets the starting point with continual use. And I would tell you guys, retinol works best for prevention. I love retinol serum. I use it every night as part of my nighttime routine, and I can tell you, everything that they're describing right here, it has done for my skin. It has helped to improve my skin quite dramatically. And I would say over the span of the last about 4 months, I started my new program in January. I started to see great results by March, and it is July 6th right now, you guys, and my skin is looking good. And you know, I don't even mind saying that, because when you put in a little effort to your appearance and your proactive aging, you are gonna look a lot better. I tell you, my motto is look good, feel good. So that's what I'm doing. I'm on it. I don't know about you. Now, let me just read a little bit more. It says that retinol actually thickens your skin by increasing production of glycoaminoglycans to the skin, and it makes it firm, taut, and smooth. And yes, I will second that motion. I have seen retinol work wonders for my skin. So those are our ABCs for today. We started way back up here at IPL, and actually I'm going to put those ABCs that I've covered today down in the description box so you can go over them and, you know, do some research on your own. I hope that you're finding benefit in these videos. I have so much fun and I enjoy bringing you this information. And the reason why I'm bringing it to you is because I know how busy we are today. Men and women are busy. They have kids, they're going to work, they're driving the kids all over the place, they're taking care of their elderly parents. I mean, we people right now are just busy. And sometimes, you know, we might go to the store like Ulta or Sephora, and we get bombarded with all these things up on the shelf, and they all look beautiful, and we want to buy all of them. And we might even have a salesperson coming over and saying, hey, you want to try this hyaluronic acid? And we're like, well, what is that? Sometimes we might not want to appear to be unknowledgeable, so we might just go along with it. So I'm bringing you these ABCs to help you have at least a little bit of knowledge about these different things so that you can make an informed decision. Like I say, I'm going to put these in the description box, and you can do a little bit more research as you have time to do it. Let me know what you guys think about all of this in the comments. So that is it for today, you guys. I hope you have loved this video as much as I've loved bringing it to you. I want to reiterate, fruits and vegetables. Eat as much as you can. This is my snack for today. Drink as much water as you can stand during the day. 8-ounce glasses is a good suggestion. Those things are going to start you up with having your body healthy, and a healthy body produces healthy skin and a healthy glow. God bless you guys for watching, and I'll see you next time.